Good morning. I'm very grateful to be here with you again. And it really has been a privilege to be able to be here in the Miami Beach community doing this series. So I thank you, Leslie, and the City of Miami Beach for this opportunity. This is number 6 in our series, which is wonderful because I believe each has built one on top of the other, which has been hopefully a good amount of information, especially from a developmental perspective, and why it's so important to keep our kids safe. So what we're going to talk about today is what you should do if your child is experimenting with substances. And I'm going to, start just with a little bit of a recap. And I also want to just start with sharing what some of the misconceptions are about what substance abuse or misuse or dependence is. And a lot of times when people don't understand what this is, it's very easy for it to be judged. Some folks look at this as a moral weakness, and really when the people that I have worked with, that I've been honored to work with, that have already crossed into the threshold of having some sort of issue with substances, I have found that it absolutely has nothing to do with morals. Values, morals, ethics, all of that is still there, but what can happen is that the person is not living in parallel with them because of their substance use. Also seen as character flaws, bad parenting. When there's teenagers that use, there's this stigma that this is, the parents' fault, and absolutely not. It's not. Kids, they know right from wrong. So clearly parenting, while it may play a role in the influence, it's not about fault. Bad habit, overindulgent, this idea that addicts are bad, crazy, and stupid people that, live under the bridges. And the truth is that people that suffer from this disease can look just like somebody like me. Common, ordinary individuals. Addiction is about willpower, and that's not the case. Behavioral problem, and also the idea that to be an alcoholic, you have to drink every day. And while the amount of use is something that we do look at, it's not a requirement, so to speak, that a person uses every day to be categorized or qualify for the diagnosis of dependence. So before we get into what to do, there's certain things that I think are important to remember, especially when we're dealing with teenagers, as we move forward in the role of parent. Things that we always need to keep in mind. One is the adolescent brain development. As we spoke about in another lecture, and just as a quickie highlight, right, the reward system, that limbic system, is pretty much developed by the time a child is 12 or 13 years old. So that part that lights up that says, I like this is good, boom, it's already done. While the executive function, the prefrontal cortex, because the brain develops from back to front, is the last thing to come in. Who knows this very well? Car insurance companies, right? They hold out till the end, till the age of 25. So we have that span there. So for a parent, very important to be the executive function for the child, and the way of doing that is by setting healthy limits and boundaries where they can navigate as safely as possible. Addiction and alcoholism is a process that usually begins in adolescence. Now, that doesn't necessarily mean that the individual qualifies or meets the criteria for dependence during the teenage years. However, the use usually begins at that age, and we have the vulnerability of the brain that plays a very major role in the development of a substance issue. Our kids are growing up right now in a world of immediate gratification. All you need is a cell phone. You have everything at the tip of your fingers. Remember the days that I'd go out to dinner with my friends and we were talking about a movie and what was the name of that movie, and if nobody knew the name of that movie, we didn't know the name of the movie, right? Now what do? I mean, I catch myself all the time. What was that movie? What was that movie? Grab the phone, reach to the pocket, reach to the pocketbook, and we have it at the tip of our fingers. And they have become accustomed to this, as Leslie and I briefly were talking about before, about the technology and the media, right? Somebody my age, I'm an immigrant to technology. These kids are natives to technology. So, you know, they navigate through there in a heartbeat, and there's nothing better than when, you know, I just upgraded my phone to grab a teenager and be like, hey, this isn't working, and within 32 seconds, it's working. You know, which would have taken me 32 days probably, but they're native to it. So they've become very accustomed to immediate gratification, and as we know, we need to also learn to exist within delayed gratification. High school is 4 years, college is 4 years, advanced degrees can be a variety of times. When we start to work, you know, we got to climb up that ladder. You get out of school with degrees, right? But then you need to get the experience. And all of these things, we need to learn to wait for it. And teaching them the value of delayed gratification can be very helpful for them moving forward in their lives. The limbic system versus the executive function we talked about, the power of dopamine and serotonin, which is the power of our feel-good neurotransmitters. If we get those neurotransmitters accustomed to being up here all the time with substances, when that person returns to doing some of those things that they enjoyed in the past, that gave them happiness in the past, things like, you know, some of our natural rewards, which is, you know, food, spending time with friends, it doesn't feel as good. And then it starts to develop this, well, you know, I need to smoke a joint, or I need to do this, or I need to do that in order to enjoy it. And the dopamine and the serotonin play very, very huge roles in that. And then the amygdala and the fear factor. Teenagers by nature feel less fear than adults. And we have to be very aware of that too, because they're gonna, you know, the chances of them taking higher risks is going to be higher than adults. Make sense? Correct. Yeah, it's in the process of the development as well too. That's a great question. Yep. I'll remember for myself, it was probably 22, 23 years old when I came to realize, oh my God, I could die if I do this, which probably had never crossed my mind before. And then it's like, oh, wait a minute, I'm not invincible. I thought I was, and I also probably thought I was smarter than everybody else, but I came to realize that was not true either. You know, because all we need is one thing to happen to us that can change the rest of our lives, right? It also takes me to that space when sometimes I have clients say to me, oh my God, this happened to me, life is not fair. I'm pretty grateful in most moments that life isn't fair, because I probably wouldn't be standing up here in front of you. You know, made it through some things that I look back on now that were just very poor decisions, and I didn't think them through, but, you know, nonetheless, here I am. And we all see it sometimes on the news, that there's an accident, there's this, it's just that one time that something can happen that can then create, it can change our world. So I think one of the things to do prior to getting even into what to do if the child is experimenting, right, is to set up expectations. And this can start from a very young age with anything and everything that we set up with our kids. It doesn't necessarily mean that they won't experiment or won't do some of these things, right? But at least they're going to know where the family stands on some of these bigger decisions based on your values, morals, ethics, and expectations of a healthy family. And at the end of the day, even with all the peer pressure and everything else, while there's a lot of influences, families still have a very, very, very strong influence and power, so to speak, over their children. Kids don't want to let their parents down. I really believe that. Even though they make decisions sometimes that are very poor, they might engage in some things that are not healthy for them and not good for them, but there's reasons that they hide it, right? They hide it because, you know, they don't want to get in trouble, because they know it's going to disappoint you, and again, not making it right, but looking at some of the other things. So to set up the expectations, it's very important to be clear with expectations. I have heard families tell kids, that I don't want you to get high, or they'll say things like, I prefer that you don't do it. When we say, I prefer you don't do it, it's still leaving that option open. I've heard parents say, well, you can't be high in this house. So does that mean they can get high and come home when they're not high? We need to be very clear about what it is that we mean for them to understand. And sometimes when we as parents say, I prefer this, or you can't be high in the house, we have to explore ourselves and be like, why are we struggling in being clear with what we mean? It's very difficult to be a parent, as you know, and I think natural instinct is when you see your son or daughter hurt or upset, angry, you don't want them to feel that way. Of course not. We don't want to see somebody in that state. So we sometimes will try and rescue them out of that, or maybe be a little bit unclear to get them to step up and make the right decision, right? And they just may not have the capacity to make the best decision at that moment. It's like when the kids, I remember I did this once with my mom, back in the day when the telephone used to hang on the wall with a cord. So phone calls, really, it was like in the public areas of the house, so to speak, so very limited privacy. A friend of mine called me to invite me to a party, and I didn't want to go to the party, but I didn't want to say to my friend, I don't want to go to the party, because then what am I going to look like? So I looked at my mom, who was standing there, and I'm on the phone, and I'm like, Mom, can I go to this party? And I'm nodding my head no, for her to say no, and she's like, absolutely not, you can't go. So I was like, thumbs up. She rescued me from that. She saved me from that. It made it very easy for me to then turn around and be like, I can't believe my mom is not letting me go. And she took it. She was like, fine, whatever, and it just made it easy for me, to make that decision. And she took it off my shoulders, in essence, which was wonderful. And sometimes as parents, we got to do that. Even if our kid says that they want to go and your child is 15 and it's a college frat party, chances are the answer is going to be no. You're not going to go hang out with a bunch of, college-age people at a frat house at the age of 15, much less we probably don't want you to do it at 18 either, but, that they might be angry. She might be angry with you, right? We'll use she or he, it doesn't matter at this juncture, boy or girl. But that's okay. If you feel that that's the best decision and that's not a good environment for them, it's okay to say no, and it's okay to be clear about it. And it's okay for them to get angry. That's actually going to probably be the reaction that they're going to have. And then it's an opportunity for them to cope with the anger rather than take it away from them. Or say yes so that they're not angry. Make sense? It's tough, though. It's tough because then, you go from when the kids are little that, you are their gods, to now you're like horrible people that keep saying no to me. You don't want me to enjoy my life. What's wrong with you? Don't you know I'm 15? I already know it all. Nope, not quite. We're getting there. Maybe in another 6 months you'll know it all, right? But not just yet. Say what you mean what you say, and don't say it mean. We've got the clarity right there, avoids argument, this is what it is, and then do your best to tie it into the family values. This way there's an understanding. Now, understanding may not lead to the acceptance that we want, however, there's that tie-in, and they're going to be aware of what it is. Within setting up the expectations, the analogy I've used before is drawing the 2 lines on the road. Those are the rules. And then they can navigate within those lines, right? And it gives them the opportunity to make choices within those lines. But you all control the lines of how wide they are or how narrow they are, and then you respond based on what it is that they do and how they behave within those lines. But having the choice. And then what transpires after every choice is a consequence. And that is just the natural outcome, the effect of those decisions. And, we have quote-unquote positive consequences and quote-unquote negative consequences. At the end of the day, it's a result of what's being done. So rather than using the word punishment comes like an authority and coming down, it allows them to take ownership of their decision. because of your choice, this is the result. This is the consequence of your actions. And some of those can be stated ahead of time. There's no way we can absolutely cover every rule that exists, but there's some that are like no-brainers. Like we hopefully don't need to sit down and talk with our child and say, listen, you don't rob banks, you don't rob gas stations, These are kind of no-brainers, right? But you could have things on there like if you come home after your curfew, the consequences the following weekend, you don't go out. If you don't complete your homework or fail an exam, you lose your cell phone privileges for a week. We can state those. And that way there's an anticipation, and it'll avoid arguments, hopefully, down the line. It'll be like, look, we talked about this, so we don't need to engage in this conversation. We don't need to go over and over on this. Or there's a percentage of the kids will come back and say, well, what's the big deal with smoking a little bit of pot? Everybody's doing it. It's legal. It's this, it's that, right? And in your home, marijuana is zero tolerance. That could be stated as, I can understand, son, daughter, that you're right. A lot of people are doing it, and some people are okay with it, and some are not. In our family, we are a family that does not use substances. This is part of our belief system. Your brain is still developing, and you're not of legal age, because they're a teenager. Even if it was fully legal here, we've got 18 or 21. We've got the different ages for different substances. That we are also a law-abiding home, and we're going to respect that because it's our sense of integrity. Does that make sense? Yep. Excellent. So let's look at what some of the signs and symptoms are. And signs and symptoms are two different things. A symptom is what an individual self-reports. I can go to the doctor and say, doctor, I'm feeling headaches, I'm feeling heart palpitations, I feel a little shaky. We can report what we feel. And then we have signs, which is what other people can observe. So when we're looking at the signs and symptoms of substance use, there's some physical symptoms that happen as well as other observable changes in personality and in behaviors and in certain ways of functioning. So one of the things we look at is tolerance. Does the person need more to get the same effect? Using the example of marijuana again with teenagers is that on average it takes a family about 8 to 12 months to know that their son or daughter is smoking marijuana. And it's not because parents are not paying attention. It's because in the beginning the use is more sporadic usually, and they tend to hide it better. Kids won't necessarily come home high under the influence, right? Because they're in the process of when they start to experiment, to learn what it feels like to be high, to learn about their body and how long the effects last. And again, wrapping back to that space that they don't want to get in trouble and they don't want to let their families down. Especially if they know that you're against it, they don't want to disappoint you. So what happens over the course of time is that they become, assuming of course that they continue to use, they start to become more accustomed to what it's like to be high, having more quote-unquote control over what that feeling is and how it's going to look on the outside, that they start taking more risks because their own comfort level with it increases. And they start to use more often. Why? Because they start to build that tolerance to it. So there's more opportunity. It's like Murphy's Law too. The more you do something, the higher your chances of getting caught. So tolerance is what we look at. But then we look at, consequences as well too. For some folks, and I may have given you this example before, but I think it's one that really is a good example of looking at the value and how consequences can motivate people. You have two people that leave work on Friday and go to happy hour, which a lot of people do. They each have a couple of drinks, hop in their car and drive home. They both are driving home, they both get stopped by the police, they both get arrested for DUIs. This can happen really to anybody, right? Anybody can go happy hour after. Doesn't necessarily mean the person's an alcoholic. It just means that there was a poor decision made there. So if the two people, one of them says, wow, I can't believe this happened to me, I'm never doing this again. The other person says, wow, I can't believe this happened to me, I need to find a bar closer to home. You have one person that responds to the consequence by like, okay, I'm never taking this chance again. You know, it'll probably, you know, take a good year to come out of all the legal stuff and everything else and the financial cost. And the other person that says, I need to find a way closer to home is somebody that doesn't really see the severity of what happened, more attributed to, you know, I need to find a way around this. And that's one of the pieces that we look at in the consequences. And then we look at the continued use. How long has a person been using? That's also going to be something that's very important. Then we need to look at the other problems that come. Sure.
So the consequence, what makes someone decide to stop using versus find a bar closer to home?
In that example, one of the things that I would do as a clinician, right, is if I had to evaluate both of those folks, what I would do with the person that says I need to find a bar closer to home, I would explore with them what other consequences they have had. They may not even be fully aware of what other consequences they have had. This might be their first arrest and their first ever legal issue, right? But then I would hop into this side here. When I evaluate somebody, I do my best when I speak to them on the phone to set up that appointment is to have somebody come with them, their spouse, somebody that's very close to them that can provide me additional information. Because that individual it's highly likely that they're going to see the situation and circumstances differently than, say, the spouse or a parent, right? So I try and get somebody else to come in with me, and if they do, great. If they don't, we're still going to move forward. Then I'm going to start to explore these other things here. Questions like, if I was to ask somebody in your family, your husband, your wife, your mom or dad, if they were worried about you, what do you think they would say? Have you had arguments related to this before? How's your quality of work? Have you had any work or school issues? Have your grades come down some? Any of your friends tell you they're worried about you? I had a teenager not that long ago that I was sitting talking with. Oh, this is no big deal. This is not a problem. And of course, I had the parents. At this point, I'm alone with the teenager, right? And the parents had mentioned that one of his friends called mom to say, listen, I'm worried about your son. When another teenager picks up the phone to call another parent to say, I'm worried about my friend, that to me is huge. So I bring that to the table. Well, why would Frankie say he's worried about you?
Had a like the history of some of these other kinds of issues.
Correct.
In which case maybe they're just more tolerant of taking risks.
Sure. You know, when we do the abnormal long enough, because that probably was an abnormal behavior in the beginning, because especially with drunk driving, I know I've been hearing about that since I was a kid. When you do the abnormal long enough, it becomes normal. So it's like, hey, it's no big deal. I've done it, 90 times before, and I haven't gotten caught. I haven't read this statistic in a long time, but a few years ago, the statistic for Miami-Dade County was that for every one DUI that a person got, it is estimated that they got away with it, I think it was 104 times. And Dr. Rosenfeld, I don't know if you're familiar with any of these numbers, but that's one I read a long time ago. But, And the people that I meet with and talk with, I'm going to tell you, and I certainly will not throw this out and generalize this to the entire population, but that number kind of makes sense to me of how that happens. So part of the evaluation process and part of looking at the signs and symptoms is exploring the bigger picture. And when we look at some of the emotional problems, and with teenagers, we got to realize that some of these behaviors are natural teen behaviors. It's just when they're above or more magnified. Anger, depression, isolation, these are things to look for. A change in friends. If the friends all of a sudden change and you don't know, who they are, and you have less accessibility to see who they are, this could also potentially be a flag. And even change in vocabulary. Sometimes you'll hear terms and words that you're like, I've never heard this before. Then we go to our friend Google. We could certainly go and Google some of these terms to see what it is that they're saying. Family conflicts, again, beyond your typical teenager kind of conflicts, we expect those conflicts. Any psychiatric problems, very important to look out for. Relationship, legal, financial, medical, educational, and social. These are other, they're in essence, they are flags. So what's the best thing to do when you see any of these things that are happening? Definitely, I encourage families always to confront the problem. We got to sit down and we got to talk about what it is that's going on. We got to be able to express and explore what it is. It's like, hey, we saw this, we saw that. What does this mean? What's going on? Who is this person that you've been going out with? Explore it, look at it, talk about it. Seek to understand. Teenage substance use really at any age, once it crosses a certain threshold, it starts to serve a greater purpose. People aren't always aware of what that purpose is, or they'll deny it. Oh, I don't use it to cope, I just use it to have fun. Okay, so why do you need it to have fun? Because right there, they're saying something. And if you hear, and I know I hear, oh, it's not a problem, and it's like, okay, but you've been dealing with this for 2 years. If it's not a problem, your parents are asking you not to, then why do you keep doing it? Because if something's not a problem and it's not a big deal to me, and you ask me to stop because it bothers you and you're important to me and I live in your house, I'll stop. That's not to say that I won't pick it up, whatever it is that we're talking about, once I'm out and about and on my own. But if it's not a big deal, you would eliminate 95% of the stress in your life by stopping. Why are you choosing not to? Help me understand. Substance use, to me, is a disease that speaks. It justifies and it rationalizes. Which is why it's so important to explore the bigger things and sometimes point out the discrepancies of, yeah, okay, it's one DUI, everything else is fine, but no, not really. Look, you've had this happen, you've had that happen, this has happened, these people are worried, and really start to put that picture together for that individual to really explore what their relationship is with the substance and what role it's really playing in their lives. Something else I like to explore when people give me the everybody does it, and for marijuana, a lot of people do, right? But it's really everybody does it. So could it be that it's where you're choosing to be versus potentially stepping out because not everybody does it? And pointing those things out. The self-medicating, again, very, very important, especially with teenagers and with young adults. We got to look for anything that might be underlying because a lot of times people are self-medicating. These days, and I was just on a trip in California on a professional weekend, so I got to speak to therapists and interventionists from all over the US, and I really appreciate finding what's going on in each part of the country and what people are seeing. And it's usually not very different from what we're seeing here. But we engaged in a conversation with the group of how with the young adults, our late teens, early 20s, how there's more and more social anxiety that is being treated, and the folks have been consuming substances to deal with the social anxiety. And it makes me think about, again, going back to the power of a cell phone. How much is that playing a role? And I get that it's the technology, I get it's, they're natives to the technology, but it really makes me wonder the value of the face-to-face like we're having right now, that you can catch my facial expressions, I can catch yours, the tone of our voice, and things written down can be interpreted in many different ways. I know I've asked for clarity on text messages and emails, just to see where are you really coming from.
Yes.
I just wanted to point out that the city of Miami Beach is funding mental health professionals in each of our public schools, and we've also partnered with our neighboring municipalities. And we just expanded that access this current month, so that next school year there will be even more days of access to a mental health professional within each of our public schools. What we have been doing in partnership with your team is providing information to the youth on these topics, and sharing with them that there's a mental health professional available to them in the public school, and also explaining to them what the mental professional can support them with. And it is exactly what you're talking about. And we strongly discourage self-medicating. And we ask them to seek out support for depression, anxiety, familial problems, anything along those lines, normal problems.
Yes.
And I think, what a family can do, what a parent or guardian could potentially do, is also encourage their child to seek out that assistance that's available in our public schools, so that they can hear someone else besides the parent, because often it's hard for children to hear from their parent or from their guardian. It's easier for them to hear it from someone else who's perhaps more objective in the student's eyes. So we have now mental health professionals in our public schools, and we really do want to encourage our families to utilize that service, meet that professional.
Yep.
Feel comfortable with that professional. So.
Excellent, excellent. Yes, I would utilize it as well. Thank you, Leslie. That makes me so happy to hear. I even got goosebumps, because it really is being able to be in front of, right, some of these self-medicating behaviors. If we can be in front of it, I think that would be great. And ma'am, you said it perfectly. It's like, hey, I would utilize it, right? Because kids sometimes, you're right, while they may feel very comfortable with their parents and know that they can have an open conversation, it can be very tough to come to mom or dad and say, listen, I'm feeling very sad, I'm feeling very this, because they don't want to worry you either, right? But knowing that you've got this full support, you've got the support at home, and now you have the greater support now at the school with more of that funding and that availability, it allows that forum where there's that trust that you can say, hey, I don't know what's going on, but I'm not feeling this or that, and to give them that safe space. And you said it, these are normal, average problems. We just sometimes don't talk about it because we think we're the only one. And when I know the times I've opened my mouth and I've said, wow, I went through a depression, how many people are like, oh my God, I did too. And I'm like, really? But I didn't even notice. And because we put on the happy face, right? We're smiling on the outside, but inside the tears are rolling. And if we have that space where we can talk about it, it becomes normalized and we don't feel alone. What a gift. Because when I look at substance use disorders, one of my rules of thumb in my mentality related to substance use is that it's a lack of intimate connection with other people. So if we can have that connection, I think it goes a very long way. I really see substance use, one of the components is it's an attachment disorder of relationships. That's why it's so important to keep talking. So important. And to know we're not alone. Because, Leslie, you couldn't have said it better. It's like, these are average problems that most of us go through. I think, if we were to poll a room of 5 people or 500 people and ask the question, has anybody in this room ever felt sad? We all have. Has anybody in this room ever felt anxious? I'd probably raise both hands for that one. We experience, and my sadness might be related to a death, and this person's sadness might be related to failing out of school. Okay, different event. We can relate to the feeling. Yes, ma'am.
So then how do you set a consequence? Here you are seeking to understand, you find out this person, lacks connection, and then you punish them.
You don't punish them.
So the consequence feels like punishment. It's like, take your cell phone away, or you can't go to that next party because you might abuse a substance. So
who does it feel like a punishment for?
I mean, the kid that doesn't get to go to the party will feel punished.
We're assuming they're going to feel punished. We'll start there. Yes, and you're right. I'm not saying that they're not going to be like, I can't believe you're doing this to me. But when we tie it into the consequence, okay, son, daughter, right? You were smoking pot because you were feeling sad. I understand that, so you know what we're going to do? We're going to find you help for your quote-unquote depression. However, the way you chose to cope with it was not the best way. Therefore, this is a consequence of your poor decision. We're not punishing him for being depressed. We're not punishing at all. It's a consequence for the way the person coped with it. It's like I can go and if I lose my job and I can't put food on my table to feed my kids and I go rob a bank and the police catches me, I can tell the officer, look, officer, I had the best of intentions. My kid was starving. Oh, the cop's going to be like, oh, okay, did they eat? Yeah, they did. What did they have? Shrimp. Okay, great. Bye. There's still a consequence for that decision. It doesn't make the decision correct.
But the therapy isn't the consequence. The consequence is not getting to go to the party.
Correct. And by not going to the party is because at the party, there probably will be exposure for that individual to make that decision again. Number 2, consequence is the best teacher that we have. Because if we don't have consequences for our actions, we're going to do it again and do it bigger because I know nothing is going to happen, and then I can come back and say it's because I'm depressed. It was when I first graduated with my master's and I was doing my internship, I was in a multi-family group where there was 2 brothers with their mother sitting in group. One of the brothers was in substance abuse treatment. The other brother was there as support, family support, as well as mom. The identified patient, quote unquote, was talking to the group and says, well, I grew up in a home where my father used to beat me. Anytime something would happen, whether it was a bad grade, whether it was, that I got home late, the response was hits. He would hit me, he would punch me. So he's looking at the group, so what do you expect from me? Of course I'm going to be an alcoholic. What do you expect? Look at what I grew up in. The other brother looks at his brother and says, I grew up in the same house as you did. When I got home late, Dad would, hit me too. When I got the bag, Dad would hit me too, But I graduated high school. I went to college. I think he was an engineer. He was a professional of some sort. And he looks at his brother, he looks at the group, and he's like, well, what did you expect from me? My father used to beat me, so I needed to get out of this house. Who's right, who's wrong? They both coped. They coped differently. They both came with consequences, right? We can understand to peel the onion to get in there, and we can do that compassionately. It's just like I've worked with parents before too that have told their kids in session, I need you to be honest with me. You know, another rule of thumb is that the truth hurts once, the lies continue to hurt. And the father was very clear, and I so appreciated this, because he looked at his daughter and said, I need you to be honest with me. I'm never going to punish you for honesty. That doesn't mean that there's not going to be consequences for your actions, but I'm not going to punish you for being honest. I need the honesty for us to work together. So he was very clear, you know, because we can say to our kids, I need you to be honest with me and there's going to be no consequence, period. You know, the honesty is important, but you know, if going back to the example of the substance use, since that would, you know, that's been the main, if your kid comes home from a party and says, hey, I got high at the party, Mom, okay, I'm being honest with you. Next weekend, what are going to be your thoughts? Mom, I'm going to a party, right? You're like, okay, you were honest with me. I said there was going to be no consequence, and you want to go back and do, you know, then we're up against the wall, and then it's like, you lied to me, so I'm not going to be honest with you anymore. Now I'm going to hide it from you because you said you wouldn't give me a consequence. What are you thinking? I need you to be honest with me. That doesn't necessarily mean that there won't be consequences for your actions. Hopefully, the sense of integrity that's being instilled. And number two is, if you catch them in something, they're then going to be able to see and appreciate that the lies are going to add bigger consequences than the truth would, and it helps to draw those lines on the road. Because we need to be realistic as well, too, that they're going to test the waters with anything and everything. And I'm not just talking drugs and alcohol, with coming home late, with potentially being somewhere that they didn't tell you they were going to be, lies, covering up. I mean, it's part of the development. And then what becomes paramount is how the family responds to the testing of the water. They're going to test it, and we almost need them to. Yes?
I'm a firm believer in being preemptive. I don't need someone to tell me that when my sons go to a party that there are teens or kids in their early 20s, that there's not going to be drugs and alcohol. We know that's going to be present.
Sure.
So I've been speaking with my children since they were little about, you know, so you're going to this party. What will you do if? Perfect. Because you are going. It's going to be present. So let's talk about it. Let's talk about the choices and how are you going to handle it. What are you going to do if you're uncomfortable? You know, we talk
Beautiful.
about it. We role play what he could potentially encounter,
yeah.
And then we hope that he makes the right decision. We ask him to make the right decision in advance.
There you go.
And then, of course, you know, when he gets home, we have a conversation. How was it? We're not, you know, it's not an inquisition. It's a conversation. How was it? How did you feel? You know, I mean, and I think as a parent, that's all you can continue to do is ask your children to make good decisions for themselves.
Beautiful.
And hope that they do, and reward them and compliment them when they are, and tell them you appreciate it and
Yep.
you trust them.
Beautiful.
At least that's, and I'm in the thick of it because I have a 17-year-old and a 20-year-old.
Oh, yeah.
So we've been there for quite a few years.
Right.
And so far we're in good shape. But
Beautiful.
I consistently continue to talk to them. Even my 20-year-old that's at college.
Absolutely.
Because the pressure there is way greater than the high school pressure.
Yeah, and like you mentioned so many valuable things, right? It's talking to them, you know, boom, as they're growing up. Part of that reward that you're talking about, right? When they come home and you're like, all right, you know, you guys did a great job, and then it's also boosting their self-esteem, which there's no better reward than the internal, right? And feeling good about the decisions that they've made. You've empowered them to make good decisions. They know where you and your husband stand on the family values, morals, and ethics that you have established for them. And you, even with your 20-year-old, right, that you don't see him every day like your 17-year-old. So more so, he has to step up for himself and have that foundation, because You're right. College campuses. I am way more current on this statistics than the DUI. That if every college student was to be assessed on, the large college campuses, it's estimated that 50% of the students would qualify for a substance dependence diagnosis just because of the nature of being in college and everything that they're exposed to, from the alcohol to the Adderall to you name it. Now that finals are going on, we have a number of university students that are studying for finals. In my mind, I'm like, oh boy, that Adderall must be flying around college campuses to get ready for these final exams. And it's in those moments with your 20-year-old away that part of the rules and the expectations, you've taught him to self-regulate himself, which is something that's very difficult in adolescence. And to make the best decisions for himself. I love how you said that, especially when nobody's watching.
And I like what you said about it has to be intrinsic. I think a mistake parents make, especially when the children are little, is the reward for good behavior is extrinsic, and those are cheap rewards. A little toy, eventually the gift will never be large enough. So it has to be a self-awareness and a self-respect, and the parent recognizing that and just telling their child, I like the choices you're making. Yeah. I appreciate your decision to respect yourself, and having them hear those rewards. It cannot be an extrinsic reward. You'll lose in that pattern. Yep. So I agree. And yes, and you need to instill early on, because the pressure only gets more challenging as they get older, and you're not there.
No, you're not. You're not. So I can, FaceTime you now and kind of put on that smiley face, and 2 minutes later go and do, whatever it is that I'm going to do. And talking about the extrinsic, right? I've seen parents with the best of intentions tell their kid, you come to rehab for 30 days and I'll get you a BMW. And I'm like, I cringe because it's like, okay, so, what, if they continue to use, because the BMW, then go to inpatient and I buy you a house? No, these are behaviors that should not have been rewarded to start with, right? So we need to start to make that shift in having them own and feel good about regaining the trust, about having the open communication, trust is beautiful. It's great to be trusted.
And I'm not saying I'm very generous with my children.
Absolutely.
But I do not link my generosity to a specific event.
Correct.
It's not linked to grades. It's not. The generosity comes simply because I like them, I respect them, I appreciate them, I trust them, and it can be at any moment in time.
Absolutely.
For nothing at all other than, I like what you're doing, I like the choices you're making, so that it's never linked to something
right,
along those lines.
Right, exactly. Stop smoking pot and you get this. And that generosity.
And that goes back to the values that you mentioned.
It goes back, right. And that generosity that you're speaking of, Leslie, to me is I think, like you said, it's something that's very innate, because they're not self-destructing. They're taking good care of themselves. So it's like, this is great to be able to do this and add to them. It's like the 2 lines on the road, because if you had to pull in those 2 lines in the road, your generosity would shift. And it doesn't mean that you're less generous. It just means that there's a shift in that because of the earning of it. It's not a punishment. It's just something that comes very natural, as does with any community, with any family, and anything that we do. So it also resonates to the outside world. And that those teachings are so important, to be able to foster that and to build it from the inside out. And love it. The communication is what's paramount, because with your 20-year-old that's away at school, he's probably not scared to tell you some stuff, because he knows you're not going to overreact, but he also knows you're probably not going to underreact, because we have both extremes. And it's about being able to have a conversation. It's great. You guys went to the party. Great. Well, how did you feel when you were there and this was going on and that was going on? Every moment is also a teachable moment. And we got to use that opportunity. There was a lady here, she's not here today, but shared an example in one of the other meetings that we had, that she was, she and her husband with their 2 kids were in the Keys having dinner at one of the bar restaurants, and the Keys, it's the Keys. And there was a number of people that were inebriated, and her gut reaction was to grab the kids and everybody and leave. But no, they stayed for a little bit, and then on the drive home, they talked about it. So what did you think about those people? Everything's a teachable moment, right? And that's a beautiful thing. We got to make sure that our consequences are appropriate to the broken rule, and consequences should be consistent, right? This comes back to overreacting and underreacting, trying to keep our cool. And granted, some things are going to be very hard to hear, that in the moment inside you're like, but being able to have that. And the being consistent with the consequences means say what you mean what you say, and don't say it mean. If you say the phone's going away for a week, stick to a week. Don't do it after 4 days, because then they know that they can manipulate, right? And it's hard because part of it is like, man, I took my kid's phone away, now I can't reach them. And then, right? And then, so it's our own thing. And they do.
If you're going to take a phone away, you need to take away every electronic device
Boom.
that they have to find a way. And that is very painful to parents.
Yes, it is.
Then they can't do their homework, or you have to stand over them. So,
Yep.
I
Yeah.
don't subscribe to that because it doesn't work.
Say what you mean. Right.
You'd have to take the iPad away, the laptop away.
Right.
You have to hide your own. I mean, it's crazy.
Yeah, no,
because
it's
they
insane.
don't need this to communicate. They can communicate
They
any
don't.
which way.
Absolutely.
They're very savvy.
Yes, they are. And then we go back to that space. Say what you mean what you say, and don't say it mean. Because if we're not prepared to do that, we're not going to say it, because then we fall into threatening. And then when you threaten and you don't follow through, right? It's just like, if I'm not ready to part with substance abuse, right? Is one of the options for an adult child is that you can't live here anymore if you continue to use. Not everybody's prepared to do that, and I respect that 100%. So then we're not going to say it if we're not prepared to do it. We teach people how to treat us, whether it's, parenting your kids, your spouse, our own parents, co-workers, you name it. By what we accept or don't accept, we teach people how to treat us. And one of the things I have found very paramount is that trust. If I tell you that this is going to happen, if this happens, it might kill me to do it, right? Because who wants to see their child upset and grounded and not having fun? No parent that I have met enjoys that. The kids think that we do, but we don't. Come on, who doesn't want their kid out there having fun, especially, teenage and early young adult years? Those are the years. But if we say it, we have to hold that line, remembering that, especially at this juncture, you are their executive function. We can't set them up to fail. And at the end of the day, we would so love our kid at the age of 16 to come home and say, you know what, mother? I know I just got my driver's license. However, I think it's very precarious that I be out past 11. So I'm going to come home at 10:30. If your child says that, my first question would be, what do they want? Second of all, chances are that's not going to happen. We have to come in and say, you know what? If 11 o'clock is the time you as mom and dad feel is appropriate, then you say, your curfew, because you're taking the car, is at 11 p.m. You need to be here at 11. If you're here past 11, and that could be 11:01 or 11:10, the consequence for that is next weekend, you don't take the car, you can't go out. Fill in the blank. The expectation is set up. The child is aware. They may come home on time. That is the hope. They may not. And if they don't, follow through on what you said, because then the next time it'll be like, I didn't get the car the following weekend. I didn't get to go out, and it was my best friend's birthday, and my mother didn't let me go. That next time it'll be like, okay, it's 10:40, y'all, I gotta go. I'm about 10 minutes away from home. I have 15 minutes in case, there's a delay along the way, I'm headed home. Because they know that you will follow through. And it's a gift. It's truly a gift because you're teaching them to self-regulate, you're teaching them to prioritize. And again, it's not to say that they may not come home late a second time or a third time, but they know where you stand, and they are hopefully making the tie of, they are the driver of the bus. I'm not punishing you because or giving you a consequence because I enjoy this. You earned it by coming home late. And then the opposite, we're talking about, for a month they come home on time, everything is good. That next time I'd be like, Mom, there's a party, can I come a little bit? Well, you know what, the last month, you've come home on time, let me talk to your dad. You know what, midnight. That's also earned. That's opening the lines on the road. Why? Because they have shown you that they were able to manage within the tighter lines, so they open up. Just like when they're open up, there's an infraction. You bring those lines closer together. You're setting them up to succeed. And some of these decisions that they may not have the full capacity to make because of the impulsivity, the reward center, et cetera, you're being the executive function. And that can sometimes just alleviate our own stress and guilt of, oh my God, am I being too hard? Because this family lets them out till 4 a.m. and, because of course, but it runs through the head, right? It's like, oh. And then inside I'm thinking like, oh, these other parents that are doing this stuff are really making my job harder because it's swimming upstream. But there's a method to the madness, It's hard to be a teenager. Your job is harder because that age is very, very, very tough. So there's different levels of care, because one of the points, oh my gosh, it's 9:00. I didn't even realize that. Just real quick, just know that there's different levels of care based on each individual. There's, at risk, which is somebody that's experimenting, that there can be some sort of education and family, always very family-based. There's intensive outpatient, which is an increased number of hours, and then you have wilderness programs and inpatient programs for people that are further along in their drug use and peer influence and environmental types of things. And always when treating, especially adolescents, we have to look at these other components as well. It's not just the drug use. They're going through I was speaking to a psychiatrist last night, a client we have in common, and with young people, they're going through 2 processes. One is the process of recovery, and the other is the process of maturity, which makes it adds different challenges than an adult. Adults are adults. So they're going through one process versus the kids that are going through 2. So we really need to attend to a lot of the issues along the way. So what to do? Educate yourself. And this is why, again, Leslie, I come back to you in the city of Miami Beach. Thank you for this opportunity, because I know many, many, many of people have participated and have learned, and it's so important to be up to date with everything that is going on in our communities. Talk with your kids before they get to the age of experimentation. Parents still continue to be in family the number one influence. Again, it doesn't mean that they won't do it. However, they're going to think about it more than potentially kids that their families are not talking to them and reinforcing the message of the family values, morals, and ethics. Know your kids' friends as much as you can. Know that it's okay to set limits and to say no. No is a full sentence. You can say no. Have consequences and enforce them. Be a role model. And if you discover a problem, please confront it. And here, I just want to take a moment to honor these. These are 4 families that in 2016, we have Guillermo, we have Kyle, Tyler, and Lisa, who died to the disease of addiction. And they started pretty much like everybody else with marijuana and alcohol. And it just went going further and further. As you can tell, very loving families. These are good families, like I talked about in the beginning. Great kids. Had the benefit of knowing 3 of 4. I did not know Guillermo, but I have come to know his family. And what I've come to learn about Guillermo through his family, as well as the other 3 individuals, is I guarantee you they didn't want to die. They never thought this disease would happen to them. I promise you that. And these are families and young people that fought very hard. This is a brain disease, and I've used this analogy in some of the other presentations I've done. You have to be the helmet for your kids, and the time is now. You got to be this executive function for them. Help to steer and guide them as best as you possibly can, and continue to love them to the moon and back. Reject the destructive behaviors. You love them to pieces. Reject the self-destruction if you see them engaging in that. And I thank you all. I thank the city of Miami Beach. It has been a pleasure and an honor. And all of you families that have come week after week watching on the streaming. And if we could ever be helpful, now we've got extra resources in the school, which is great. You have the city of Miami Beach that can be contacted. You can contact family recovery specialists. Anything we can do to help you help your families would be an honor and a privilege. So I thank you all.